Parth and CCS team. Privileged to come here and share our views on this very important subject. Now, I would like to distinguish between the concept of universal basic income and direct benefit transfer. If you just go back and see how the term DBT came into existence and how UBI has come into existence. Actually, if you take UBI in its classical sense, universal basic income, it's actually not in practice anywhere in the world. It's a kind of a utopian idea, and various definitions we have. There are many empirical definitions, and in the last 10 years, I think there's been an explosion, particularly after the Swiss referendum that took place in 2016. There's been a lot of interest in universal basic income for a variety of reasons. And each country, each nation is coming to this idea for its own, as part of its own continuities and discontinuities of its own welfare history. Now, there have been several experiments, including in India, in Madhya Pradesh. SEVA and UNICEF together has done a major pilot study. We will briefly touch upon that as well. In fact, Namibia was the first experiment which took place in one village called Otiwara in 2008, which was also universal within a village. And Finland recently has started its own experiment, but it's focusing more on the unemployed youth. So they have identified randomly about 2,000 unemployed people. And so Finland is trying to address the problems of its own welfare system, its own delivery system, its own, the way, what the existing inefficient system has done to the whole idea of equity. Similarly, Ontario they had actually commissioned a study, and they are starting a rollout of its own experiment. And in Auckland, I think Y Combinator has a private initiative, has started its own experiment. So if you see a universal basic income, neither can you say that it's a kind of a socialist idea, socialist parties are interested, nor can we say that it's a capitalist idea, mostly the neoliberal regimes are interested. It's very difficult. Somewhere I think universal basic income comes and breaks that binary of this or that. In fact, I think we have a major philosopher called Philip Van Parijs, who has been writing about basic income for the past 30 years. He says that he wrote a very interesting article called Universal Basic Income, a Capitalist Road to Communism. So where he breaks the binaries and talks about equity. So in this kind of din, when we talk about basic income in India, there is quite a lot of confusion about what we actually mean by it. So last 1 year, I think there have been about hundreds of articles, particularly after Dr. Arvind Subramaniam opened the whole discussion, the last economic survey with his chapter 9, famous chapter 9. So let's look at it as a UBI as a Weberian ideal type rather than any concrete policy which is in practice. When I say a Weberian ideal type, I'm saying that it's an abstraction which one has culled out from various definitions that one sees across these experiments and across the discussions. Okay, I've identified 7 elements. It's universal, which means that all citizens resident in a country are supposed to get it. It's unconditional, no conditions whatsoever. You ask no questions, you just pay this money to the citizens. It's a cash transfer, it's not in kind. It's periodic, preferably monthly. When I come to our study, I'll see the psychological effect of the monthly. And it's individual. Every child, every woman, every man is entitled to get it. It's an inalienable right. It's for lifetime. It's not something that you can take away with each new government coming and say, okay, let's not have UBI, let's have something else, or let's make it conditional. So it's an inalienable right for life, and it's inflation indexed so that you preserve the value of what you're transferring to the people. So this is, as I said, this is in abstraction. Now, you also have in Europe some of the basic income groups actually talking about high enough. It should be high enough, which is actually saying that it should be able to give a subsistence to people. Well, now there are 2-3 things I'll just clarify, that when countries like United States, when countries like Northern Europe are talking about a basic income, universal basic income, usually the discussion is coming from the threat of technology taking away jobs or the future prospect of jobless growth. So it's usually coming from there. But I think it has created a lot of energy. When I think Silicon Valley honchos talk about universal basic income, like Elon Musk and Mark Zuckerberg, they're also coming from this futuristic point of view that in future, maybe we don't need so many human beings to produce in production, marketing, and distribution. So it's coming from there. But when we apply to India, we are not coming from there. We have working classes, but we have multiple working classes. We have, on the one hand, the cutting edge IT professionals. On the other hand, we have the landless laborers, the other end of the spectrum. So in basic income, if we want to apply in India, want to tweak that concept to India, we are coming from the poverty discourse. That in what ways can universal basic income, interpreted in the Indian context, can address the poverty issue, and in what ways is it a departure from the existing ways of addressing poverty issue in India. Okay, I won't go into this because there's a full book on this study that we have done in Madhya Pradesh, but I'll just quickly say that coming away from the abstraction to the concrete experiment, that in our experiment in Madhya Pradesh, which we have done 8 villages, we have taken and 1 pilot, and second pilot is 1 tribal village, just to understand the difference from a caste-based village and a tribal village. Now, it was universal within a village. We took 1 village and we gave it to everyone. It was unconditional, no conditions were there at all. It was a cash transfer, it was individual, and it was monthly. Now, before I go to that, let me quickly say that the results of this 18-month transfers that we have made in Madhya Pradesh, the results have been really very positive, much to our own surprise, because I think giving cash to people is something that there is a problem that we cannot accept, because it's fungible, because it has so many things. In fact, one of the major philosophers who writes about basic income said that in the last 30 years, the main objection to basic income, universal basic income, has been a moral objection. If you see chapter 9, the way Dr. Subramaniam has worded it, he said it's a conversation with and within Mahatma, by which we are actually saying that it's a moral question. Should we give people money, cash, for whatever reason, without asking any questions? Is it a fair thing to do? Is it the right thing to do? But I think mostly our knee-jerk reaction would be to say, you can't give it like that. You have to have some kind of social engineering built into it so that you nudge people or you persuade people in that direction. So the results have been, coming to the education part in our study, let me just briefly say and close and come to the other part, that in the education, the school enrollment had increased, attendance had increased, particularly girl enrollment had increased, for which we are still unable to find why particularly girl enrollment has increased. In fact, even performance in the school has also increased, though for performance we could not get the proper data from the school. Now, the other thing that happened was that in Madhya Pradesh, during the time we did the study, there was a rash of private schools that came. So there was a preference to shift from public school to private school. But then what was the extent of shifting, we could not figure out, because government schools would not remove the students who left the school. They leave and then some people come back because their own funds depend on how many children are there. Anyway, so then 4 years later, we went back and again to the same villages and did a study where we found that on the question of moving to the private schools, there was a kind of a fallback. Those who went away from the government schools came back. I think the liquidity was the factor. The moment they didn't have the liquidity, the project was over, many of them actually came back. So that was very disturbing. Now let me come to how I understand DBT, which is the main discussion. I think subsidy, we all know. I don't have to explain this much, but I think it's government has a view on the subsidy bill that it has and the delivery costs. I think Dr. Montek Singh Ahluwalia's famous calculation that India spends 3.25 rupees to deliver 1 rupee, which means you are actually allocating 4.25. I think he has written as a foreword in our study of TPDS. That's the kind of, it's finally you see that it's ridiculous. So obviously in terms of efficiency, in terms of governance, I think in order to remove the corruption and leakages, one has to do this. I think government's successful story on LPG experiment, the savings that I think 2010-11, 60,000 crores was the allocation. This year, 20,000 crores is allocation. That's the kind of shifts that you see. Now, so the government obviously is thinking of replacing other inefficient systems of delivery, in-kind delivery, and do this. The point is that DBT is coming from a very different direction. UBI is coming from a very different direction. I'm not saying they are two very different things, but there are intersections between the two. So we cannot say that UBI and DBT are the same. Now the question is, in chapter 9 of the economic survey, in that discussion, there's a leap from DBT to UBI. The moment you come from DBT to UBI, then you have to face a whole lot of questions about universal, quasi-universal. There's also a proposal that should we give it to all women, so on and so forth. Now, my basic question here, I think the question that we need to ask, that why does welfare delivery fail in India? If we are talking about, we have been talking about TPDS leakages, PDS leakages, I think those people who support cash transfer versus those people who wants the status quo to remain. In the arguments, the difference is only about 47% to 42%. Those who say, no, it has improved, the delivery has improved, they are saying 40 to 42% leakages are there. I mean, 42% are, it's criminal. I mean, we can't accept it. No, it was 47%, but it's only 42%. I mean, so this 1 rupee delivery is actually 1 rupee is not reaching the last man. It's only the 60 paise or less than that is reaching there. So my larger question here is that why does Kendriya Vidyalaya work and the village school doesn't work? Why AIMS and ISRO work, same public sector, but the village primary health center doesn't work? So is there a self-fulfilling prophecy, or is something to do with our caste system that the last man doesn't deserve, it need not be given, he should be given poor rice, bad rice, or bad wheat, or a beggar is never invited into your dining hall and given fresh and hot food. You always give yesterday's food. So what is that psychology by which our welfare delivery is such a pathetic story? So with this I close that in the case of universal basic income, how do we tweak that idea to the Indian context, coming from this abstract philosophical idea? So, I mean, the whole idea is to raise the floor in the Indian context, as Junaid has already pointed out. The point is to raise the floor for all people, all citizens, so that when they fall, they don't fall on the rock bottom. They have some kind of a cushion. So it gives a certain basic economic security. So as I already said, with how different, what is our starting point, how it is different. The question is, should we move towards targeted universalism? In the sense, take one demographic group and give it to all, or should we, like what government is trying to propose, that should we give it to all women? So I think, how do we simplify targeting? So as far as UBI is concerned, I think those are the questions. With that, I close. Thank you so much.
Thank you, Sarath.